Welcome to another Quality Analyst Group presentation. Today's topic is in reference to credentialing and contracting APRN providers. The objective for the day is to identify the different types of mid-level providers, understand the difference between credentialing and contracting a mid level provider, identify how failure to credential mid level providers when applicable will affect claims and audits, clarify the states and payers' specific guidelines before scheduling appointments. Mid-level providers in healthcare includes nurse practitioners, physician assistants, certified nurse midwives, clinical nurse specialists, and certified registered anesthetists. This providers are often referred to as Advanced Practitioner Registered Nurse, APRNs, or Advanced Practice Providers, APPS. The term mid level providers is also used by the DEA to refer these professionals who are licensed to dispense controlled substance. Scope of practice. Mid level providers have a defined scope of practice, which varies by state and the specific provider type. Mid level providers are often not physicians, but they are still authorized to diagnose and treat patients, often with a degree of independence. It also helps to protect the organization and the mid level provider from potential liability if there are any issues with patients. What does it mean to credential a mid level provider? Credentialing a mid level provider means a process to verify their qualifications and ensure they can practice safely and effectively within the healthcare setting. It involves a thorough review of their education, training, experience, and professional history to ensure they meet the required standard and are eligible to receive clinical privileges. Credentialing is designed to safeguard patients and the organization from potential risks, including malpractice claims. It goes beyond a simple background check, requiring verification of various aspects of a provider's credentials, such as their license, training, and experience. Mid level providers are often not physicians, but they are still authorized to diagnose and treat patients, often with a degree of independence. Credentialing also helps to protect the organization and the mid level provider from potential liability if there are any issues with patient care. What does it mean to contract a mid level provider with a payer? Well, I'm sure you're wondering, can we even contract a mid level provider? Well, yes. Mid level providers can often be included in group contracts with payers, but it depends on the specific contract and payer requirement. In some cases, the contract may cover all providers within the group, including mid level providers, and the payers may only need to credential the group as a whole. However, other contracts may be required individual contracts for each providers, including mid-level providers. Even though a mid-level provider can have a group contract with a payer, it depends on a variety of factors, including the payer's policies, state laws, and the terms of specific contracts. It is critical to review the contract and understand the payer's requirements to ensure proper billing and compliance, says the American Academy of Family Physicians. Benefits of contracting practices from the ability to expand their patients' care capacity and addresses areas of high demand, while mid level providers gain greater autonomy in practices and the opportunity to specialize. Considerations for contracting. Practices should carefully consider the legal and regulatory requirements for contracting mid level providers, including supervision requirements, credentialing, and reimbursement policies. Can an APRN or mid-level provider become credentialed with payers and not be contracted? Oftentimes, people get the idea of being credentialed and contracted confused, which is why this was a very important question. Well, the answer is yes. It's possible for a mid level provider to become credentialed and not be contracted with pay, but it depends on the specific payer and nature of the contract. Credentialing verifies the provider qualifications with contracting, establish a reimbursement agreement. Contracting. This involves a formal agreement between the provider and the payer, outlining the terms of reimbursement, such as fee schedules and network participation. Billing under supervisor. In some cases, a mid level provider can be credentialed but billed under a supervising physician, national provider identifier, particularly when incident to billing is applicable. However, this is not always the case, and some payers may require med level provider to be individually contracted. Out of network billing. If a mid level provider is not contracted with a payer, they may still be able to provide services and bill as an out of network provider, but patients may be responsible for the higher costs or out of network benefits. Here are some examples of how some states may allow MPs to practice independently. And here are some examples with how some payers may allow providers to have affiliated or group individual contracts. To avoid negatively affecting compliance, claims, and audits, follow your state and payer specific guidelines. What are some guidelines that can affect compliance and credentialing if they are not adhered to? As always, we encourage providers and entities to adhere to their state and payer guidelines. Incident to billing. How does credentialing affect incident to billing? Credentialing directly impacts the incident to billing process by ensuring the physician and non physician providers are appropriately verified for the service rendered. For incident to billing, both the physician and the non physician provider must be employed by the same practice. Furthermore, the physician must be credentialed with the insurance payer for the services provided. Incident to billing in the medical billing refers to a method where services provided by non physician practitioners are billed under the supervising physician, national provider identifier. These are must be an integral, although incidental, part of the physician professional services, performed under the physician direct supervision and billed under the NPI. Be sure to avoid these common mistakes and roadblocks. Follow your state and payer guidelines. Assuming since the provider cannot be contracted with payer, that also means that provider cannot be credentialed. In some cases, this is incorrect. Some payers will still allow providers to be credentialed. The credentialing status will allow these providers to work as an affiliation to the group. Applying incident to billing for a provider that should have been credentialed can cause major setbacks. Be sure to follow your state and payer guidelines. Looks like we're at our last stop. Here are some the biggest takeaways. Be sure to follow your state and payer guidelines to avoid negative impacts with compliance, claims, and audits. There are specific payer and state guidelines for credentialing and contracting. Be sure to follow the rules. Thank you for your attention and see you soon.